The HIV control rules in North Carolina had not been changed since 1988. And the rule said that if you were HIV positive, you had to tell all of your future sexual partners and you had to use a condom every single time. So what that meant was that for anyone who was living with HIV who came up with anything else sexually related, it was clear proof that they had violated North Carolina's control measures. And so there was the potential for a misdemeanor charge and jail time.
Most of the individuals who were being charged with crimes were a majority people of color, especially African Americans, and so there was a big need to change these laws and get those updated.
We had talked about changing our HIV control policies for several years, but got very serious about it in 2016 because the science had come together and made it clear that the rules that we had were really outdated and antiquated. So we spent the better part of 2016 and much of 2017 working on that and planning for it.
Our control measures went into effect January 1st, 2018. And since then, every patient I've seen, I've told them about the change in the control measures, and I cannot tell you the number of patients who've cried or just the sense that, we were moving forward and we were acknowledging that they are human, they're not going to infect other people, they're not dirty. It was just, for me personally, it was emotional.
I think for other state health departments that are looking at changing their HIV control measures, it really does come down to educating the rule changers about our current science and the fact that 90,000 acts of condomless sex resulted in no transmissions between the couples who were studied. That's powerful. So I think the states are going to need to work from that perspective to make sure that their lawmakers, their rule changers, understand that that is where we are now.
What you can learn is that you need to bring everybody to the table. You need to make sure before you make a major change like this that you're utilizing the science to guide and push the change through. Change has to happen, and whether it's hard or it's unwanted, it still needs to move forward.
One of the ways I think this new law has impacted individuals who live with HIV is that individuals now are more comfortable with being who they are. They don't feel as stigmatized as they have before. As someone who had to sign one of those control measures when I was diagnosed and was given my diagnosis, I know how that felt, how demeaning it felt, and just made me feel like some diseased monster or something. So having these laws changed takes away some of that negative feeling of people.
You don't need a law that restricts people who can't transmit a virus, can't transmit HIV, because that person is undetectable. Take your valuable resources and direct it toward overcoming the barriers for the people who aren't virally suppressed. That's a lesson we need to keep learning here in this country, and I think it's certainly one that could be used globally as well.
We at NASTAD recognize that to end the HIV epidemic, a really important piece is to guide the laws and policies that are being put in place in health departments and in ministries of health to be based on science and to be based on the evidence. If there are laws in place that criminalize these marginalized communities, if they criminalize their existence living with HIV, then it perpetuates stigma and discrimination.